Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie Rubin. I am a registered dietitian and I mainly work with clients struggling with a host of symptoms from underlying inflammatory and autoimmune conditions. In my work with my clients, I help them implement a personalized nutrition roadmap really designed to help them improve their lives and get back to where they should be. So this March, I'm recording this in March, and it is Autoimmune Disease Awareness Month. And every week this month, I have talked about a different autoimmune disease. So if you haven't watched my prior videos, please go back to watch them. We talk about rheumatoid arthritis, Hashimoto's, and multiple sclerosis. And today we're finishing it off with inflammatory bowel disease. So inflammatory bowel disease includes both ulcerative colitis and Crohn's disease. Both of these autoimmune conditions affect the gastrointestinal tract and can be extremely debilitating during periods of flares and inflammation. So today I'm covering what these diseases are, how they're diagnosed, what the treatment is, and what you can do both diet and lifestyle-wise to help reduce your symptoms. So before I jump in, I just need to attach my disclaimer that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes to your medical care. Inflammatory bowel disease is a collection of autoimmune diseases that affects the gastrointestinal tract. The two main types are Crohn's disease and ulcerative colitis. In Crohn's disease, inflammation occurs throughout the entire gastrointestinal tract. Anywhere from the mouth to the anus. It typically affects the small intestine and the top part of the large intestine. Inflammation can occur in patches and can penetrate all layers of the GI tract. Ulcerative colitis, on the other hand, is mainly concentrated in the colon. And in this disease, inflammation is a continuous thread that affects only the innermost lining of the colon. And inflammation occurs when the body's immune system attacks the healthy tissue in the GI tract. So while the inflammation patterns are different, the symptoms of both ulcerative colitis and Crohn's disease are very similar. And according to a 2016 study, approximately 1.2 million adults and about 57,000 children live with inflammatory bowel disease in the US. So what are the signs and symptoms? Individuals with inflammatory bowel disease experience symptoms really only when their disease is flaring or active. So in some cases, symptoms can come and go, making it difficult to diagnose early on. Some of the most common symptoms include things like abdominal pain, diarrhea with blood sometimes in the stool, bowel urgency or fecal incontinence, rectal bleeding, weight loss, anemia, malnutrition, anxiety, and depression. Other symptoms that may happen that are unrelated to digestion include arthritis or stiff joints, mouth sores or ulcers, fatty liver, eye inflammation is actually very common, and poor circulation. So with any autoimmune disease, getting an inflammatory bowel disease diagnosis can be totally overwhelming and very complicated. Like all autoimmune diseases, there's no single test to confirm that what you have is this. So your doctor will likely do a series of tests and evaluations. They'll usually start with a medical history assessment, ask about your diet, your lifestyle, and family history. And then getting a diagnosis of inflammatory bowel disease requires multiple tests. The initial tests are typically the less invasive ones, so a blood test or a stool test, and additional testing will include either a colonoscopy or an endoscopy. And your doctor may also do additional imaging, such as an MRI or an X-ray or a CT scan. Some of the more common blood tests include C-reactive protein or your erythrocyte sedimentation rate, which are both markers for inflammation. Your stool test will look at calprotectin and lactoferrin. Both are markers for GI inflammation. And then endoscopies or colonoscopies will take samples of your tissue and analyze them for mucosal or tissue damage or abnormal cells. And it's important to mention that there's actually two other forms of inflammatory bowel disease. One is called microscopic colitis, where inflammation is only visible through a microscope. And then the other is called indeterminate colitis. And this condition features both kind of characteristics of Crohn's disease and colitis. So there are a few classes of drugs that are used to target inflammation in inflammatory bowel disease. These could include things like corticosteroids, which are powerful anti-inflammatory medications that are used on a short-term basis to stop symptoms. This includes things like prednisone, which we're all familiar with. There's something called 5-aminosalicylic acid medications, or 5-ASAs. These are used for mild to moderate inflammatory bowel disease and are typically more effective for ulcerative colitis. They work on inflammation to help lessen diarrhea and abdominal pain. Then there are immunomodulators, which are medications that suppress certain parts of the immune system, so it stops attacking the GI tissues. These are usually taken after corticosteroids to also when symptoms are more manageable. And then there's biologics, which are medications to stop certain parts of the immune system from overreacting. And these are often longer-term medications that can be combined with immunomodulators. So along with or instead of medication, diet and lifestyle can go a very long way to help relieve symptoms of inflammatory bowel disease. In terms of diet, there's several options to choose from. The easiest one to start off with is the Mediterranean diet, which is really great at reducing inflammation. This eating pattern includes fish, fruits, vegetables, whole grains, healthy fats from nuts and olive oil, and limited amounts of dairy and red meat. The next option is a paleo diet, which is a little bit more restrictive. And then the more restrictive version of paleo is the autoimmune protocol elimination diet, which or otherwise known as AIP. So there have been a couple small studies that have reported remission in just 6 weeks after following the AIP diet in patients with inflammatory bowel disease. So that's very promising. And then lastly, there's something called the specific carbohydrate diet. This diet removes hard to digest carbohydrates to help improve digestion, remove any sort of like bacterial growth or inflammation from the digestive tract, and again, reduce inflammation. So there are some smaller studies that have looked at this diet and found it to be effective in inflammatory bowel disease patients. This diet excludes foods like grains, starchy tubers, canola oil, most dairy products, candy, chocolate, some beans, sugars, and then it includes things like meat, shellfish, fish, eggs, certain beans, certain cheeses, most vegetables, most nuts, and most oils. So with any diet, especially the more restrictive ones, I would recommend seeking help from a qualified professional as anytime you're following a very restrictive diet, it can be very challenging and we are at risk for malnutrition. And that's something that we definitely do not want to face when we have an autoimmune disease. In terms of lifestyle, just a couple of suggestions. One is really spend time on stress resilience. Not stress management, living with our stress. We can't ever get rid of our stress, but it's important to be able to understand how to help it, how to work with it. So your gut and your stress are very connected, the mind-gut reaction. So anytime that you're very stressful, it'll affect your gut. So you really want to be kind of mindful and cognizant about your stress levels. And then gentle movement also really helps to reduce inflammation. Other things that can help with inflammation includes, getting out in nature, getting really good sleep, trying to activate that parasympathetic nervous system with like yoga, deep breathing, those types of things. So just to recap, today we focused on inflammatory bowel disease, what it is, what the symptoms are, how it's diagnosed, and what the treatment options are available. If you would like more help reducing your symptoms of your autoimmune diseases or inflammation, I would love to chat with you. Please go to my website, which is in the bottom in the comments, and you can book a free discovery call with me. If you liked the video today, please hit the subscribe button. These come out about every week, and I'm always talking about something related to autoimmune diseases, inflammation, and diet and lifestyle. So thank you so much for joining me. I will see you next time.